The book Handbook of Local Anesthesia, 6th edition. Author Stanley F. Malamed, who has DDS and he is a professor of anesthesia and medicine in the School of Dentistry in the University of Southern California, Los Angeles, California. This book has about 441 illustrations. Publisher Elsevier. Contributors Daniel L. R. 2, who has done BS, DDS, MS in anesthesiology, and he has the PhD, and he has JD and MD. He is a professor and director in oral and maxillofacial surgery and advanced pain control in the University of Nevada, Las Vegas, School of Dental Medicine, Las Vegas, Nevada, and he is also a clinical professor in oral and maxillofacial surgery of the University of Nevada School of Medicine in Las Vegas, Nevada. And the second contributor is Mark N. Hodgman, who has done his DDS in private practice limited to periodontics. He has orthodontics and implant dentistry, specialized dentistry of New York City, New York. He is a clinical associate professor in New York University in College of Dentistry, New York City, New York, and he is also a clinical consultant in Milestone Scientific Inc. Livingston, New Jersey. Now the contents includes part 1, the drugs, part 2, the armamentarium, part 3, the techniques for regional anesthesia in dentistry. You can say regional anesthesia or local anesthesia. Part 4, complications, legal considerations, questions and future. Part 1 includes chapter 1, neurophysiology, chapter 2, pharmacology of local anesthesia, chapter 3, pharmacology of the vasoconstrictors, chapter 4, clinical action of the specific agents. Chapter 1, neurophysiology. This chapter is discussed in the 4 headings. Heading 1, desirable properties of local anesthetics. Heading 2, fundamentals of impulse generation and transmission. Heading 3, mode and site of action of local anesthetics. Heading 4, the active forms of the local anesthetics. And heading 5, kinetics of the local anesthetic, onset and duration of the action. Now the desirable properties of local anesthetics. Here local anesthesia has been defined as loss of sensation in a circumscribed area of the body caused by depression of excitation in nerve endings or inhibition of conduction process in the peripheral nerves. An important feature of local anesthesia is that it produces this loss of sensation without inducing loss of consciousness. Note, this produces loss of sensation without inducing loss of consciousness. Important. In this one major area, local anesthesia differs dramatically from general anesthesia. Note this point. Local anesthesia, there is no loss of consciousness. Many methods are used to induce local anesthesia that include 1. Mechanical trauma. See, the compression of the tissues will induce the local anesthesia. 2. Low temperature, for example using the ice packs. 3. Anoxia, that is lack of oxygen. 4. Chemical irritants. 5. Neurolytic agents such as alcohol and phenol. 6. Chemical agents such as local anesthetics. Important. However, only those methods or substances that induce a transient and completely reversible state of anesthesia have application in clinical practice. The following are those properties deemed most desirable for a local anesthetics. 1. It should not be irritating to the tissue to which it is applied. 2. It should not cause any permanent alteration of nerve structure. 3. Its systemic toxicity should be low. 4. It must be effective regardless of whether it is injected into the tissue or is applied locally to the mucous membrane. 5. The time of onset of anesthesia should be as short as possible. 6. The duration of anesthesia must be long enough to permit the completion of the procedure, yet not so long as to require an extended recovery. See the point 5. The time of anesthesia should be as short as possible, which can be achieved by administering the local anesthesia close or proximity to the nerve. And sixth point, the duration of anesthesia. It depends upon the local anesthetic drug used.